Of Wilmington.
Well, welcome back. In this week's medical interview, we have Dr. John Anagnost. He's an oncologist with the Cape Fear Cancer Specialist, part of the Hanover Regional Medical Center Physician Group. And with October being Breast Cancer Awareness Month, well, we're staying with that theme and talking about genetic testing for breast cancer. So, doctor, we'll start right there. What exactly is a genetic test for breast cancer awareness?
The test we're particularly interested in is called the Brca test. And it's a particular genetic test that's come out in the last several years that has a great deal of importance for us. The Brca gene is something that's in all of us, and it's a gene that helps us repair DNA, which is part of our biology.
Sure.
When there's a mutation, then repair doesn't occur, and now you can have problems. In this particular case, breast cancer. And so the Brca mutation is associated with breast cancer, with pancreas cancer, with male breast cancer. So we've become very interested in this gene.
Now, you mentioned that the test is one of the newer tests. How much more specific is this, and how is that helping patients today?
Well, if we see certain characteristics in the family, family members with ovarian cancer, family members with breast cancer under the age of 50, we become interested in doing the genetic testing. If we find the person with the gene mutation, we now look at the rest of the family. And the strength of the test is that now we can advise other people in the family what they can do to prevent and significantly reduce the possibility of developing breast cancer or ovarian cancer.
Now, is this an invasive test? Talk a little bit about the procedure itself for patients.
The way the test would be done is, for many years, it was a blood test, and so it was a simple blood draw. But what's now come out is basically a swish test where we just get the cells from the inside of the cheek.
Oh, wow.
So what you can do is swish and spit, and now there's enough cells that come out in the material that we can examine that. It takes about 2 weeks for the test to come back, and then there's a collaboration between a genetic counselor and a physician. As on one hand, you learn your risks of certain things happening. And the most prominent person that this occurred with was Angelina Jolie, who is a carrier for the Brca mutation, and after hearing her risks of developing breast cancer, elected to have surgery to prevent that from happening.
Now, with that test being so easy, has it gotten to where there's really no excuse not to have this done?
I think the difficulty is the awareness. The awareness on the part of physicians to realize the family history is significant enough to ask that this test be done, and that the insurance companies allow us to get this test paid for.
Ken, as we always say, that if you have any questions, you always want to consult your physician, especially in an area such as this where family history is so prevalent. Doctor, we appreciate it.
Thank you, sir.
Thank you for coming in and spending time with us this morning.